Hi, Brew Crew, and welcome to the Morning Brew podcast. Well, in the spirit of the Thanksgiving season, today we're talking about giving back to the community and the profound feeling that comes from selfless service, as it does impact both the giver and the receiver. Today, we're exploring the heart of community and the joy of giving back. And for that, I can think of three individuals who better represent service to community. My very special guests today are Sister Maria Luisa Vera, Sister Rosemary Welsh, and Sister Beth Yoist, all three of them with the Sisters of Mercy, who have dedicated 130 years to serving the Laredo, Texas community. So without further ado, welcome, sisters, to the podcast. I know Sister Beth is going to be joining us in just a little bit, but first of all, congratulations on 130 years in Laredo. I mean, that is just unfathomable to think of the amount of years that this organization, that the Sisters of Mercy, have been with us. And I want to start off this podcast for those who are not familiar with the Sisters of Mercy. Tell us a little bit about the Sisters of Mercy. That's just not here in Laredo. This is nationwide, correct?
Well, actually, it's worldwide.
Worldwide.
And there is a worldwide organization called Mercy International. And we belong to the Sisters of Mercy of the Americas, which includes the United States, the Philippines, Latin America, the Caribbean.
Wow.
So it's bigger than this. But we're blessed to be part of the Laredo community. And I often think of Laredo today, and I think, what was Laredo like in 1894?
When you came
When
here.
the sisters came here. And then to consider women from Ireland. And if anybody's ever been to Ireland, you can immediately say, wow, how did they do it? And it's just that one kind of thing. But I think the one thing is that they came in a spirit of service, being invited to come and help organize healthcare here in Laredo. There was a small medical community of less than 5 physicians, I think, and they came with no medical background, and but they had a willing heart and eager to serve. And some of our documents, our archival material says that the doctor said to them, you leave the medical part to us, and you help the community understand what we're doing here. So that's been the mission from the beginning. And of course, as you know, we sponsored a hospital for over 100 years. Mm-hmm. And then we've transitioned, based on what's needed today.
Mm-hmm. So Mercy Hospital, obviously, is the hospital that you're talking about. That hospital, so let me backtrack. It was in 1894 when the Sisters of Mercy were invited to come to Laredo. And like you said, it was a very underserved community. We're still underserved today, but back then even more so. So the Sisters of Mercy were tasked to come to this small community just to explain or educate the community, or how are you all going to partner with the 5 physicians who are here? What was the mission?
Actually, what they wanted us to do was open a hospital.
Okay.
Yeah.
And within several weeks, they did. For not a lot of beds, but they did. They were invited to help begin organized healthcare in this community.
It just did not have organized healthcare back then.
So they were asked, and within a couple of weeks, we were able to open a hospital, several beds. But I think the thing that first of all, we were invited. Number 2, folks came and they wanted us to be here. And immediately, Mindy, this has always been a community that has welcomed us, and I think other groups, because we want to work together. So they invited to start something, and with a lot of people's help, we did it. And over years, over 100 years, actually it was 3 or 4 different hospitals that we moved to, and then the last one on Saunders. And I think it was at the time, what we were asked to do, we did. But Mindy, we have never, ever said that we've done it alone. We always had a lot of collaborators, don't you think, Sister?
Oh, definitely.
And that we couldn't have done it, nor would we want to do it. It's not the style of the Sisters of Mercy to come in and say, we're going to do this by ourselves and our way. We've always collaborated, I think.
That's true. And I think that was the intent of the doctor saying, the sisters gather the community behind this effort. The first hospital was on the corner of Rosario and Loring.
Wow.
And it was a house, a 10-room house, and 6 rooms were dedicated to patients, and 4 rooms, including the kitchen, were the sisters' quarters. So that's how they lived until they moved downtown across from Jarvis Plaza. Not the building that's there now, but the property. That was the second hospital, and then on Tilden was the third hospital.
How many sisters came down in 1894? It was a group of how many?
Four.
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 With nursing background?
None.
No background at all. Because I know, Sister Rosemary, you are,
And so Sister, we're
both of you
nurses.
guys are registered nurses
Right.
today. But
They
back
had
then, not at all. So they knew how to run a hospital? Because obviously very successful.
But I think what the point was that they asked us to come and organize a community,
Got
to
it.
be with the community, and the sisters had a history of being able to go into different places, Pittsburgh and other, to work with the community. And then the doctors were going to help with the medical part. So it was a collaboration with the doctors who knew. And shortly thereafter, the sisters learned. In fact, we started a first nursing school here in town.
Really?
The LVN program, and then the nursing school. We had an X-ray school. We had a laboratory school. We had a blood bank. First time that anybody
A registered blood bank.
right
Yeah.
in this community.
Yeah.
So we were really, the sisters came and they said, what do we need to do? And they would do it. So we were really proud of our collaboration in the community. And then we said in 2003, 1999, we moved to the new hospital. And in 2003, it was decided that we would leave organized health care.
Now, you were saying that the hospital had moved since 1894 because it just was expanding and expanding, and you just
Yeah.
kept needing a bigger space.
Well,
correct?
Laredo was growing a lot at that time, and it was a major railroad center. And you know, like when you think of that, and you think of the trucking and the transporting that's going on now, but they were having accidents, and there was no way to do a surgery or anything like that. And I think the sisters had no nursing background, but they understood three things that are very important to the health and well-being of a person, and that was nutrition, fresh air, and good water. So those were the things that they paid a lot of attention to have water, fresh air, and nutrition. And without that, your patients would never recover. And cleanliness above all, you know, and we always get tickled that we said that we're probably some of the best cleaners around. And it comes from, you know, the experience of those who have gone before us. But even in nursing history, and this is a kind of a little side story, but there were Sisters of Mercy that served in the Crimean War with Florence Nightingale, the woman who is,
yes,
you know, known for nursing. And they learned from her that fresh air was very important, to have air circulating so you're not recontaminating, you know, and that kind of thing. And those things were transmitted to the sisters because of their own living situation. They were very limited in their resources, but they tried very hard to stay healthy.
Wow.
And then Sisters of Mercy served in the Civil War, and that's a whole other story.
Wow.
So there's a lot of healthcare, you know, inherent in the Sisters of Mercy.
And one other thing that happened is that Mr. Nixon closed the base here. And
President
at
Nixon.
President Nixon. And there were a lot of nurses that were with their husbands or with their wives, and they worked at the hospital. So when they closed the base, people were really beginning to say, well, then what are we going to do for nurses?
Staffing.
But we had the LVN program, and then they began to go for the RN. But some of the best nurses I ever worked with were the licensed vocational nurses. And then when they were able to, they went on to become RNs. But it was the school, I mean, they we need more nurses, so what are we going to do? They really thought they were, because I knew some nurses. I graduated with a nurse in St. Louis, Missouri, who married a guy that was sent down to Laredo.
Wow.
And they were real surprised that the base closed so quickly.
Yeah. Well, I could, you know, I might be out on a limb by saying that our healthcare structure here in Laredo obviously started with the Sisters of Mercy back in 1894, but it has since continued, and I think your mission and your scope of work has gotten a little bit bigger since 1894, and that is what we're going to talk about. We're going to take a very quick break, but when we come back, we're going to talk to the sisters more about what they're doing now and how their scope of work has even more tentacles out in our community. So stay with us, don't go anywhere. We'll be right back.
Why pay a monthly fee? Free checking at IBC.
Welcome back, everybody. In this segment, we are paying homage to Thanksgiving and the Thanksgiving season, and we're talking to individuals who exemplify the meaning of giving back and service to the community. We've got members of the Sisters of Mercy here with us. They are celebrating 130 years in our community, and in our first segment, we were talking a little bit about the history of the Sisters of Mercy and how they came to Laredo to establish healthcare here. In our next segment, we are going to expand on the services that they've been doing over the last 130 years. And I am so pleased to welcome Beth Joyce, Sister Beth, who has joined us together with Sister Rosemary. And, you know, I wanted to focus a little bit on how you've transformed your mission and your scope of work. You know, at first, the mission back in 1894 was to help establish healthcare here in our very underserved community way back then. But eventually, you were saying that the hospital's Mercy Hospital did close down. It was sold, but that didn't mean you were going anywhere. The Sisters of Mercy were going to stick around and just expand your scope of service in our community. So let's talk a little bit about what happened after the hospital closed down, Sister Rosemary.
Well, I think one of the things is we felt that it was just a good transition for us for many reasons. We don't have to go into it, but we felt that we did want to leave Laredo. In fact, we were some of the places when we sell the hospitals, everybody leaves. And we really love this community so much that we really wanted to stay. And we had a primary health care clinic in South Laredo. So we said, well, we'll continue that. And the focus would be education,
and this
prevention, and early detection through education.
Right. And sorry to interrupt you, just so that our viewers and those listening on Spotify, that's the Sisters of Mercy Clinic that is off of Zacatecas Street.
Yeah, thank you.
Okay.
It's Mercy Ministries of Laredo, is off Zacatecas, but we own that building. So we just moved back. It was like going back home. So we continued the services there. And many of the employees that worked with us at the hospital chose to come with us. So it was a really good transition. And we really wanted to spend more time keeping people out of the hospital by education and early prevention, early detection. And the other thing is that I think that we have great relationships with both of the hospitals. And Laredo Medical Center we have more because of the proximity of the hospital, but they help us in many, many different activities. So Mr. Liao was at a function we had the other day, and he said, our hospital still has the heart of mercy, which made us very proud, because I think that we left a legacy there and continue to move in a way that we thought was maybe just a little bit better for us at that time. And at the same time, if I quickly, we had Casa de Misericordia, which was started by the Sisters of Mercy and was not sponsored by the hospital when we started it.
Let's talk a little bit about Casa Misericordia, because you expanded your scope of services to the community by really taking on domestic violence. And you've always, like you just mentioned a little while ago, education seems to be at the forefront of everything you guys do. Even with the clinic, a lot of your preventive programs, like you said, to keep people out of the hospital is so important to you. Let's talk a little bit about that and your philosophy of finding a medical home, and then let's talk a little bit about the domestic violence shelter.
Well, we think it's very important, and we've worked with both hospitals about this. If everybody that is listening today had a medical home, and what does that mean? Where do you go for your yearly exams? Where do you get your vaccines? Where do you go to get checked up if you have diabetes or whatever, or on a regular basis? So in an emergency, of course, you need to go to the hospital, but where do you go to keep well, so you don't have to go to the hospital? So we have a big thing going with a lot of other agencies. Everybody, whatever your economic status, should know where to go to take care, to get the care to keep you out of the hospital.
Right.
Education. And then, as I said, we were asked again to start a shelter in 1998. And it was because we were working with Mr. Joe Rubio and some other individuals. We had an issue, and I'm here to tell you we still have an issue.
On domestic violence.
Domestic violence in our community. But the other thing is that we collaborate with a lot of different agencies, with law enforcement, with the hospitals, with the schools. We need to do more to prevent it, to get into the grade schools, middle schools, high schools, so domestic violence does not start. I'm a little disappointed after 27 years. I think we still have a long ways to go.
Wow.
But I think we have wonderful staff. And again, it's in a collaborative effort. But domestic violence is a public health issue. Some people say, what does that have to do with health? It has everything to do with health.
Sure.
It's a public health issue. So I think that's something that concerns us, but we continue to say education is the key.
Yeah. You know, and what you just said right now is so profound, sister, because if kids grow up seeing domestic violence in the home, then they will grow up and be a part of domestic violence, whether you're the female, whether you're the male, because, and we all know domestic violence happens with both, you know, genders. So, but it's something that they possibly could have grown up with. So that's why you go through great lengths to try to educate kids when they're younger.
And even because they normalize the behavior, they think this must be normal.
Exactly.
But we have staff members that do nothing but that for the education. We were spending this whole month to go in all the Head Starts, talking to the the parents. Yes.
Wow.
Well, we're talking to the parents to allow us later on to get some information. And people want to, you know, kids aren't born to be violent. They have to be taught.
It's a behavioral, yes.
And so I think that's one of the things. And we have a wonderful community. I don't want people to think that we really made huge strides, but we still have a lot to do. So I never like to pat ourselves on the back. The same thing about health care. All of us need to work together. So one day we could close Casa de Misericordia. And I think that put it to some other use. It's not going to happen in my lifetime, but I think our whole world is violent. TV, I don't care what anybody says, sister, you're old, you don't understand, we love those programs. But some of them are pretty violent. And I think kids think all that is normal. So I don't know what, Beth, you're working in the schools.
And that's exactly what I wanted to talk to you about, Sister Beth. You, like you did, you work at schools, you teach, and you know, you have found your passion staying in our community, doing that. Talk a little bit about what you do and why you're so profound to do that.
Well, when I first came here, I worked at St. Peter's, and I taught there for 10 years. Then I became its principal, and I closed it. And I knew I was going to close it. I knew I would have to. But I wanted to close it with dignity. So that was my goal when I went there. But now I'm subbing for the United ISD program. And I also teach at St. Peter's the confirmation class. Now their confirmation, I do a lot of service projects with them. One of the things they'll be doing, they're gathering now food so we can put baskets together to give to 5 families. They also bring in 3 times a year these little bags that we can give to the homeless, because St. Peter's is right downtown, right where the poor are. So we put together these little bags that they can open up, and we put silverware in them. Well, not silverware, but plasticware in them. Because I think it's important for our kids to know service is important, and it's part of our Catholicism. Part of being Catholic is to be of service to each other. So now I do see a lot of violence in our schools. Not a lot, but, and I don't want to say like our schools are very violent. They're not very violent. But there are kids who are angry. There are kids who are hurt. There are kids out there that we as adults should be taking under our wings and saying, it's not all bad. Let's do something. I taught at STEP for 1.5 years, just at STEP Academy. And one kid came to me and said, why do you care about us? Our family doesn't care. Our country doesn't care. Why do you care? And I said, because you're worth caring about. Said, okay? And he said, I don't get it. Wow. That really says a lot when a kid says, I don't get why someone cares about me. And we helped that kid a lot. You know, he was abandoned by his family. He was abandoned by his country. He's not, documented. Yeah. So I said, we got to help this kid. So we did. What I saw at STEP Academy was kids would bring food in for him because I knew he didn't have anything to eat after school. So they would bring food to him, and they would give it to me, and they would say, here, pass this on to him somehow so he can take it home, so he has something to eat for the weekend or something to eat for dinner. So even though that school has a bad reputation of all the bad kids go there, they are very sensitive to each other's needs.
Yeah.
And our kids aren't bad here.
Yeah, and I think that they need individuals like yourself to just really, put your arms around them and embrace them and show them that they are loved. And I can't think of a better organization. This is what you all were meant to do back in 1894 when you were invited to come to Laredo, is take individuals, wrap your arms around them, and tell them that they are loved. Well, on that note, we got to take another break. We have our sponsors who are so grateful for sponsoring Morning Brew. So we're going to take a quick break, but stay with us. We're going to continue our talk with the Sisters of Mercy. We'll be right back. Welcome back to this episode of Morning Brew, and we do want to thank our sponsor, International Bank of Commerce, for providing us with a Morning Brew this morning. And, we're talking about this giving of Thanksgiving, and we're talking about how the Sisters of Mercy are celebrating their 130 years here in the Laredo community. And I can't think of a better way to express thank you to the Sisters of Mercy for establishing healthcare here in our community, and how they can be used as an example to others about giving back, because that is exactly what this season is about, but giving back throughout the entire year. So I want to talk a little bit about what the future is for the Sisters of Mercy. Tell us that you're never leaving Laredo, because you just do so much. And we just, I know that you celebrated this year 130 years, but what are the next few years like for you guys?
Well, I think one of the things that we're doing now, thinking about the future, is working with our coworkers and our Mercy associates to understand the charism of Mercy. And the charism is the particular way that Mercy does things. And as we've said before on other occasions, the Sisters of Mercy take a vow of service. In religious life, most congregations of women and some brothers, men, take the poverty, chastity, and obedience. And the Sisters of Mercy take a vow of service. And that has a history of its own. Because the time that the congregation was founded, most communities were monastic. They were cloistered. They didn't go out in the community. So in Ireland, the sisters started going to visit the sick in their home. They visit people who were imprisoned, and people out on the street, and they got the title of the Walking Sisters.
Wow. Because
they were out and about. And so, and today, some people, like we've said before, everybody is not a fan of the Sisters of Mercy. And they say in Spanish, siempre andan en la calle. They're always out on the street. But there's a legitimacy to being out on the street. It's about finding where the needs are.
Right.
So that's the charism. Look, where are the unmet needs? Who's being neglected? Who's been left behind for whatever reason? And so those are some of the things that we think about, because we know that we're not going to be here forever. But it doesn't mean that other people cannot carry on the spiritual and corporal works of mercy. I think every baptized Christian, and we have many friends who are of other faith traditions. Basically, when you start talking to people, we find out we all want the same thing. We want people to be treated with dignity and respect, to have what they need to live a life of dignity. And that's what we're working on with our coworkers, to inculcate that And how, like Sister Rosemary always says, how you do it is not, you'll find your way, but why are you doing this? And it's to serve those who are in need of service. So that's what we're focusing on, because we're very realistic. I mean, when you look at us, how long we've been around, not 130 years, but a good chunk of that. And we know that that it will, it will go on if people really capture the spirit. And I know there's many, many organizations in Laredo. If you just look around, all the wonderful works that are going on by many, many different organizations, and they're all addressing a particular need in our community. So that's really basically.
Yeah, I believe that, and also I believe that the part planning for the future, and we've been doing this at both of the ministry, it's succession. Who, when we're not here, you could have a car accident and not be here tomorrow. What are we planning that people can step in and have the same, not to forget the why, and to make sure that so we have a very orientation of both ministries, and it's not any better than any other, but we do have a different way of, that everybody that comes to the door, and I think most everybody does that, you want people to be treated. We had a little prayer this morning. Look the patients or the clients in the eye. Look like you want them to be there. Make them feel like they were the only person that you've seen that day. And I think that's what we need to continue to do. And we have wonderful employees, absolutely wonderful employees. And I think they challenge us. Sometimes they say, Sister, we don't want to do that. And that to me is a red letter day, because when they say, I do not, people, yes, people. Well, Sister said, no, Sister might have an idea, but it might be a bad idea. We need to have people that can speak up and say, to do mercy today, this is how we should do it. So I'm not really concerned. The thing I'm concerned for all of us is that whatever we're having problems in our lives, or the situation in the world, or whatever, we do what we can this day to make the people that we have met feel a little bit better about themselves. That could be somebody you go to the grocery store. Thank them for their service. Sometimes they say, what are you thanking me for? I'm thanking you for being so nice and being kind. And I think that can turn somebody's life around. We have people sometimes say, Sister, we knew you like 20 years ago. And I always say, please tell me I was nice. And they said, you always looked like you cared. And so I challenge myself, and that when I die, how will people remember me? And I think if we can help people to say, I want to make a difference today, this minute. And that's what we need to help with the kids. I think our children will not learn how to be giving and give back if they don't learn it, whether at home or with some kind of, like Beth was saying, at school. They learn absolutely everything with us, how they dance, how they pray, what they eat, how they eat, and how they treat their elders or how they treat their moms. So I think being a parent and having children, and congratulations of your parents, it is a huge responsibility. But we think the difference we can make, and I was walking down the street the other day and I dropped something. No, somebody picked it up and they said, oh, how can we help? And I said, I know I really look old now. And they took my hand and were helping me. You know? But that's the kind of thing you want kids to do.
I think today there's so much violence and so much anxiety and fear. And sometimes people are not even sure why they're feeling the way they're feeling. Catherine McCauley, the founder of the Sisters of Mercy, used to say, there is something that people value more than anything, and it's a patient listening of their sorrows. Sometimes it just takes somebody to listen. People come to us and we hear these incredible stories, and there's no way in the world that we can do anything to help them. They say, but you listened. You know, and I think that's very, very important, especially today. There's so much anxiety and fear and anger. Usually the anger comes from confusion and fear inside. So listening to people and encourage them to seek professional help. We don't ever put ourselves out, you know, as counselors or anything, because we're not. But we know enough to send them or to encourage them to seek the help that they need. And I think that is so important, because today there's a lot of confusion about a lot of things that we don't need to get into. But
absolutely.
I think one of the things, Sister, just to follow up on that, and I think our time's coming, that I think we as Sisters of Mercy and Beth and all the sisters that have come through, we want to thank this community.
Yes.
We want to be so thankful that you received us 130 years ago. You can, the hospital, when we left the hospital, people continued to work with us. It wasn't an easy decision for us to make. People have continued to surround us with love and good ideas and calling us to be Sisters of Mercy. We learn from others how to be better Sisters of Mercy. So I think we would like, the three of us would like to thank you for having us today and helping us to be better Sisters of Mercy. But the community has loved us and embraced us and taught us how to be better people. And one of the ladies told me once, you not only loved us, sister, you let us love you. And I think that's an important aspect.
Well, you're thanking the Laredo community, and the Laredo community thanks you.
Thank you
thank
so
you,
much.
sisters, and Sister Beth, for everything you've done for the community, and just to continue the legacy of Sisters of Mercy. We appreciate you, especially during this month of giving thanks, but not only this month, but all the time.
Thank you.
Thank you so
Thank you.
much for
Thank
coming on
you,
Morning
Mindy.
Brew. It's
Thank
been
you so much.
extremely inspirational to have you with us. We appreciate it. And that does it for this episode of Morning Brew. Have a wonderful Thanksgiving season from our family to yours. We appreciate you, and we thank you for tuning in every week to Morning Brew.